Hello, my name is Dr. Kian Samimi. I'm a board certified plastic surgeon. I practice here in San Diego. I've been in practice for over 20 years, and I perform a variety of procedures. One of the more common procedures which I perform is liposuction. Liposuction is a very popular procedure that yields good and predictable results in the right patient. Liposuction can be done in different settings. Liposuction can be done either in the surgery center under general anesthesia or in the office under a straight local anesthesia. When done in the office under a straight local anesthesia, the areas are basically infiltrated with a very dilute numbing solution that numbs the area and allows me to perform liposuction. I still use this numbing solution even when I perform the procedure in the surgery center, as it helps with post-operative pain, bleeding, and bruising. This technique is called a tumescent liposuction, which is considered the gold standard in liposuction and is probably the most reliable and safe way of performing liposuction. Saying that liposuction is not a means of losing weight. Liposuction can only remove a limited amount of fat during a procedure, and once we try to increase that amount, it also increases the risks and complications of liposuction. Liposuction is ideal for a person who's in good physical shape, who is close to their ideal weight, and has fat deposits which don't respond to exercise or diet. These can be hereditary, and liposuction is a great tool for treating these areas. Basically, during liposuction, first I infiltrate, I inject the dilute numbing medicine, and then through very small incisions, I use generally small cannulas to minimize the risk of having irregularities, and I remove the fat in the areas that you wish to have removed. The results sometimes take longer to be visible, as the swelling can persist for several months after liposuction. Recovery after liposuction generally is pretty quick. The pain depends on how many areas are treated and on your own pain tolerance, but generally you're able to return to most of your activities within a week. I do need you to wear a compression garment, a garment after liposuction that puts pressure on the areas that have been treated to minimize swelling, bruising, and help with the recovery. This garment has to be worn for 6 weeks, pretty much 24 hours a day. It can be taken off to take showers and for short periods of time, but generally you do have to wear that garment. The liposuction has to be done by somebody who's experienced in doing it. Liposuction can have complications, and in the hands of an experienced plastic surgeon, it is a very safe and rewarding procedure. Most important is to have realistic expectation as to the outcomes. Not all fat can be removed, and as I had mentioned earlier, it is not a weight loss tool. I can only take out 3 to 5 kilograms, about 6 to 10 pounds, at the most during a liposuction procedure, and which for most people is not a significant weight loss. I again can perform the procedure in a surgery center with anesthesia or in the office under local anesthesia. If I perform it in the office under local anesthesia, I can only treat 1 or 2 areas to make sure that I can adequately numb these areas up. Complications after liposuction are not very common. Irregularities can happen, and therefore I use very fine cannulas which reduce that risk. major complications are really related to large amount of liposuction, which I do not recommend. Large volume liposuction can lead to significant blood loss and fluid shifts, and that's where most of the complications that are mentioned in the press and talked about come from. One option at the time of liposuction is to actually save the fat that has been suctioned and use the fat to inject it into areas of your body that you wish to have treated. Most commonly, we use the fat in the buttock area, in the face, sometimes in the breast, or in the hands. Those are all areas where fat can be injected. Fat grafts have a limited take. I expect about 30 to 50% of the grafts to take, but not all of them will take, and it varies from person to person, and it varies from area to area. The benefit of using your own fat, though, is that I can harvest large amounts and that it's your own tissue and generally is very safe to inject if done properly. I invite you to come in for a consultation to discuss your options in person and see what is most appropriate for you. Thank you.